All right, so the first test we're going to do is the Trendelenburg test. So this test is evaluating the integrity of the gluteus medius muscle. So to start this test, you're going to stand in front of the athlete. Okay, and you just want to find a bony landmark here. If you're on the anterior aspect of the athlete, finding their iliac crest is the best way to do it. You can also find their ASIS if you want, but you just need something that you're going to be able to have a permanent visual aid with. So I would suggest you have the athlete put their hands on top of their iliac crest, and that's where they're going to maintain their hand placement through the test. So you're looking at that level when you perform this test. So you're then going to have the athlete stand on their left leg. When they do that, they're going to lift their right leg, okay? And you're looking for them to keep a parallel stance of their hips, okay? So neither their right or their left hip should drop. Now, if you see a positive test, you're going to see that non-stance leg hip drop, okay? What that's going to indicate is a weakness of the gluteus medius on the stance leg or the involved side. So that would be a positive test, and then a negative test would be if they are able to keep their hips level, okay? Next test we're going to do are a couple on the knee. So go ahead and lay down. So the first test is going to be your Lachman's stress test. So this is evaluating the integrity of the ACL, or the anterior cruciate ligament. So for this test, it's very important to make sure that the athlete is relaxed. If they are tense at all, you're not going to get a very good test. And you're looking for that anterior shift of the tibia on the femur. So you are going to see some normal joint play here, as you can see in this video, but you're looking for that tug of the ligament when you take it through an anterior stress of the tibia on the femur. Next is going to be the anterior drawer test. This is also evaluating the ACL. So for this, you're going to sit on their foot just to kind of stabilize the distal aspect of the leg. You're then going to apply an anterior stress of the tibia on the femur. So you're basically pulling away. So again, keep in mind you're going to see some of that normal joint motion, but then you're going to pull and you're looking for that tibia to shift forward. One more time. Good. All right, you can also do a posterior drawer test here, which is going to evaluate the integrity of the PCL. Okay. Same kind of thing, you're just now pushing posteriorly with the tibia on the femur. Okay, again, looking for that tug. No, there is going to be some normal joint play, but looking for the tug of the PCL to indicate that ligament is nice and strong, or if you don't feel it, it could indicate that there's an issue with the ligament. Now we're going to do the, come stand over here. We're going to do a valgus stress test for the MCL. So I've drawn the MCL here where it pretty much runs, okay? So similar to the varus and valgus test that you did for the upper extremity, same kind of thing here. So your left hand is going to stabilize the upper leg, so you're right over the lateral aspect of the knee. Your right hand is going to stabilize the lower aspect of the leg, and what you're doing is you're going to apply that valgus stress to that ligament. So you're going to do this at 0 degrees first, and then you're going to do it at 30 degrees, okay? Again, just looking for that tug at the ligament. When you do it at 0 degrees, you're testing both the ligament, the joint capsule, as well as the medial musculature, and then when you take them into 30 degrees, you're strictly just isolating that MCL ligament. Now when we come around, you're going to do the LCL, okay, and I've drawn it here to indicate, you can stand wherever you need to. You want to stand? I've drawn the LCL here. So same kind of thing, you're now just applying a varus stress to the outside of the knee, okay? So again, stabilizing, and you're adding a little force to the lower leg to try and increase the tension on that ligament. So a positive test is going to be any joint gapping on the lateral side, any pain that the patient might report, and then just an inability to feel that tug of the ligament kind of restricting your motion. The last knee test we're going to do is a Thessaly's test. So go ahead and stand up. So for this test, we're evaluating the integrity of the meniscus. So we're going to have the athlete standing on their uninvolved leg first. They're going to slightly bend their knee, and they're then going to rotate from side to side. And the clinician, you want to hold their balance as they do this. So what you're looking for is the indication of pain in the actual joint space, whether it's medial or lateral. So we'll then switch over. Oh, sorry. We'll then switch over and do the involved leg. Now we did the uninvolved leg first, we're doing the involved leg. Okay. So the patient is reporting pain when they do it initially. I would advise the clinician kneel down and actually have their hand on the patient's knee, so that way they can actually palpate the joint space while the athlete is going through this test. And we're going to do a couple of tests of the ankle. So the first test we're going to do is your anterior drawer test. So similar to what you did at the knee, now we're just doing it at the foot. And this test is going to evaluate the integrity of the anterior talofibular ligament. So you're going to bring them into slight dorsiflexion, stabilize the lower leg, and you're just basically pulling that heel forward. Again, feeling for the tug of the ligament to indicate whether or not the ATFL is torn or not. We're then going to do what we call a talar tilt test. So to do this, you want to put the athlete in talar neutral. Okay, so palpate their talus. Okay, and then you want to feel it shift back into that neutral appearance. Okay, and you're then going to stress them into inversion because we're going to be testing for a lateral ankle sprain here. So kind of pulling the foot and ankle into inversion to indicate or to assess the integrity of the calcaneofibular ligament. You can also do this into eversion to stress the deltoid ligament if we're talking about a medial ankle sprain. So it's a very versatile test here. The last one's going to be your Thompson test. So you're going to lay on your stomach. So for this test, we're evaluating the integrity of the Achilles tendon. So the Achilles tendon is really easy to find. You can palpate it here on the athlete. Okay. And what you're going to do for this test is you're actually going to squeeze the gastroc muscle. And as you do that, you're going to activate the gastroc. So you're looking for that foot to go into plantar flexion. If you do this test and the athlete has some sort of Achilles tendinopathy or maybe a gastroc issue and you're trying to rule out an Achilles tendon rupture when you do it, you're not going to see any motion at the foot. They're going to kind of stay right where they are when you activate the gastroc.